One of my biggest concerns when I reflect on the pandemic is to do actually with healthcare workers. And it's largely because most healthcare workers, certainly who are frontline, were exposed to the virus very early on. In early 2020, and certainly by October of 2020, when we had the other wave of COVID. And what it meant is that they would have had to have natural immunity. And so when mandatory vaccines came in, one of the questions was, are we discounting this natural immunity? You had to realize that at the time, for people who were considered high risk, they were often taken away from the front line and would operate from home because we knew who the high risk were. Now, sadly, some of the healthcare workers died in the early wave of the pandemic. But I can remember even in early 2020 or late 2020, I was asking the question, what were the outcomes between the first wave and the second wave for healthcare workers that were facing the virus? Because by that time, I had a pretty good understanding of the trigger and the importance of interferon and how the exposure to the virus, once it was not no longer novel, it was unlikely to trigger severe COVID-19. Now, some people still died in the second wave, but based on what I was looking at the time, I suspect the numbers were significantly lower among healthcare workers in the second part of the wave, which is about October to December, than it was in the first wave in March to April. So, these are important questions, and it got me to thinking about it. And I'm going to share with you some ideas as to what I think should be done to look more carefully at what happened, especially to the unvaccinated healthcare workers. Have they all died? Are they still alive and well? Do you know any? Can you imagine that? Somebody actually knows one or two that survived? Interesting questions. Before we start, as a reminder, as usual, are you prepared against disease X? And we're number one in Amazon in viral diseases. We're still likely to be in the top 10. You can get the link to Amazon here. And very shortly, we'll be adding a link to our very own book vault, which should be at a lower price. So keep up to date and join our newsletter if you are interested. So let's get back to this question. And I'm sharing with you some ideas that I came up with in the short term, just trying to capture my thoughts on what exactly is going on and building different cohorts. So I'm going to share with you some of the ideas that I've had. You can think about it and add any information or any cohorts that should be included in this and should be studied in more detail. So I've put them into 6 separate groups. You have the unvaccinated, either mild disease, moderate disease, vaccinated, not boosted, and then the vaccinated and boosted. And I'll go through each one in a little bit of detail and then we'll come back to it at the end. But the purpose of that was just for me to get some idea as to what were the outcomes in each of these cohorts and for me to explain why I think this is important. The first thing you have to understand as to why these questions are being asked is that I am looking at everything from an autoimmune paradigm. And so that you grasp what that is about, take a look at this slide. This was from my Advanced 360 presentation over almost 60 modules of information, almost 8 hours of content as I broke down the research I'd been doing over the past 4.5 years. But here we have what I consider the full spectrum of COVID-19. Asymptomatic COVID, or I'd better call it subclinical COVID, was the most common, where people had very little symptoms, if any at all. And then I added this is more to do with Omicron, COVID bronchitis, where people have this 100-day cough, and it's just ongoing, and it indicates inflammation of the upper airway with the cough. And then you had the COVID viral pneumonia. Now, this is important because some people had a viral pneumonia with secondary bacterial infection, and if they had underlying lung disease, they could have died from this. But this is not the same as moderate COVID or severe COVID. In both of these, the critical thing is the microclots. So you always had a viral inflammatory pneumonia with some secondary bacterial infection. But on top of that, you had microclotting all through the lungs, which would damage up to 90% of the alveoli and cause people, even on intensive care, to die. That's the difference between moderate and severe COVID 19. It's just the numbers of microclots and the amount of alveoli that were damaged. Important, based on my paradigm with severe microclots, once you see that, that's different from the viral pneumonia. That's an indication that that person had an autoimmune response or the cytokine storm to severe COVID 19. That's why these questions are important. So let's work through this again, one step at a time. So look at the cohorts again. Here we go. First cohort is the unvaccinated healthcare workers. They didn't have any severe COVID. They had mild or subclinical disease. They were frontline workers in 2020, often faced the pandemic at that time without masks or even PPE. They did not have severe COVID 19 and they remained unvaccinated and are still frontline. So, what that means is that they were still facing the virus at that point. They were frontline in the context of facing the virus then and facing the virus now. Did they all die? It's an important question. That's the cohort really that epidemiologically we should really want to know what the outcomes were. In the UK, it was almost 10% or more of the healthcare workers that were in that category. So that's a big cohort. Are they all still there? You may wonder. Anyway, let's move on. The next cohort were again unvaccinated, but they had severe or moderate to severe COVID 19. Some of them died, sadly. They were again frontline workers, faced the pandemic. Some had severe COVID 19, moderate to severe, and moderate to severe COVID 19 usually means they had to be admitted to hospital needing oxygen. Some of them died. They have remained unvaccinated and are still frontline. This is an important cohort. What happened to them? If they survived moderate to severe COVID 19, what were their outcomes? Very, very important piece of information. So that is the second group. In the third group of people is now where I start to shift to the vaccinated cohort. And again, in this vaccinated cohort, healthcare workers, they didn't have severe COVID 19, but because they were frontline, you anticipate that they already had exposure to the virus. They did not have severe COVID 19, but they went on to be fully vaccinated and actually not boosted, but are still frontline. They only had 2 doses of the vaccine. So this is a slight error here as I was typing it up. So in this one, they were not fully vaccinated in the sense they only had 2 doses and they're still frontline. So that's another cohort. What were the outcomes with them? Then my third or my fourth cohort is to do with vaccinated healthcare workers who had severe COVID 19. Now, follow this carefully. Again, they were frontline workers, but they had moderate to severe COVID. They are not fully vaccinated and boosted, but still frontline. That means they had 2 doses of the vaccine. They already had moderate to severe COVID 19. What is the outcome of this cohort? A really important cohort to try and work out. Because you have to remember that what we're trying to figure out at this stage is, did everything work as it should? Is there any cohort that we have to mitigate risks on? What should we do? The fifth cohort I have here are again vaccinated and boosted healthcare workers. And these ones had severe COVID 19. And so in this case, they had moderate to severe COVID. They were boosted with at least 3 doses, but they're not up to date and they're still frontline. So they are still facing the virus. And so my question is, in the context of hybrid immunity, and especially in the context of my view of autoimmune paradigm, because they have had that, are they at any greater risk in the context of not having the full amount of booster? And how does it compare to the unvaccinated? And then the final cohort I have here Again, fully vaccinated, fully boosted healthcare workers. Again, they were frontline and they may or may not have had moderate to severe COVID 19. But I usually would want to see, especially with moderate to severe COVID, because these indicate that they already had a risk. They are up to date with all doses and they are still frontline. This is another important cohort. If they did better than another cohort, especially the ones who only had 2 doses, we need to understand why. What was the mechanism when we think about it? And so, this is what I mean in terms of looking at all these cohorts together to try and analyze what happened. The one that they should have told us about is what happened. I don't know if you know any in this cohort who are unvaccinated, had either very mild or asymptomatic infection early in the pandemic, worked frontline, are still frontline, still facing the virus. It's not possible that they could have survived, is it? That's not fitting in with what we have been told. And that's where it always comes to, is there an elephant in the room? And so looking at the outcomes with healthcare workers will give us an idea, an extrapolation that we can probably use in terms of the whole population. Why has this not been done? Is it that nobody has thought about it? Maybe it has been done, but the results aren't shared. I don't know. But these are really critical questions and questions that we should all want to know the answer for. I can't think of a good reason why somebody wouldn't want to know the answer for this. And so, as I complete the end here, just a reminder, remember Disease X. You can get it at the link. It will be in the description below. You can get it on Amazon, and soon we'll be able to get it at Book Vault. We'll send that out in our newsletter as well, so that everybody can participate in reading this valuable piece of information and share with everyone around you. We want you to be best educated, to know the most about what's happening in COVID, and critically, to be able to explain it to everyone else. Have a great evening.